Depression is a complex and deeply impactful mental health disorder that affects millions of individuals across various backgrounds and life stages. It is far more than simply feeling sad or down for a short period. Depression involves a prolonged and pervasive sense of despair, low mood, and a loss of interest or pleasure in activities that once brought satisfaction. The condition can interfere with every aspect of life, including personal relationships, work performance, physical health, and overall functioning. Understanding the causes, recognizing the symptoms, and knowing the appropriate interventions are critical for practitioners working in the mental health and wellness field. The causes of depression are multifaceted and often result from the interaction of several contributing factors. Biological influences can include imbalances in brain chemistry, genetic predisposition, or hormonal changes. For example, some individuals may inherit a greater vulnerability to depression if there is a family history of mood disorders. Psychological factors such as chronic stress, unresolved trauma, or early childhood experiences also play a significant role. Additionally, social influences including isolation, prolonged exposure to adversity, or lack of supportive relationships can create an environment in which depressive symptoms are more likely to emerge and persist. Symptoms of depression can vary in severity and may present differently in each individual. Common emotional symptoms include persistent sadness, hopelessness, irritability, and feelings of worthlessness or guilt. These emotions are often accompanied by cognitive symptoms such as difficulty concentrating, indecisiveness, and recurring thoughts of death or self-harm. Physical symptoms may include changes in appetite and weight, sleep disturbances, fatigue, and a noticeable slowing of movements or speech. Depression can also affect motivation and energy levels, leading to withdrawal from social interaction and avoidance of previously enjoyable activities. One of the defining features of depression is its impact on daily functioning. Tasks that were once routine or manageable may begin to feel overwhelming or impossible. Individuals may find it difficult to get out of bed, perform household chores, or maintain employment. Relationships can suffer as communication breaks down, emotional engagement declines, and irritability increases. In severe cases, depression can lead to complete social withdrawal and the belief that recovery is unattainable. These challenges highlight the importance of early identification and comprehensive support. Interventions for depression must be individualized and multifaceted to address the unique circumstances of each person. Psychological therapies, particularly those that focus on cognitive and behavioral patterns, are often central to treatment. These therapies help individuals recognize and reframe negative thought patterns, build coping skills, and re-engage with life in meaningful ways. Techniques may include structured goal setting, problem-solving strategies, and emotional regulation exercises. Therapy provides a safe environment where individuals can explore their feelings and begin to make sense of their experiences without judgment. Lifestyle changes also play a significant role in managing depression. Regular physical activity has been shown to improve mood and reduce symptoms by increasing the production of natural chemicals in the brain that support well-being. Adequate sleep, a nutritious diet, and structured routines contribute to improved energy levels and emotional stability. Additionally, social support is a crucial factor in recovery. Maintaining or rebuilding connections with family, friends, or support groups can reduce isolation and provide encouragement and accountability during the healing process. In some cases, collaboration with medical professionals may be necessary to address biological aspects of depression. This may involve assessments to rule out underlying health conditions that could be contributing to depressive symptoms. Health practitioners may also work with clients to monitor physical symptoms and ensure that any additional interventions are well coordinated. It is essential that this process remains client-centered, with clear communication and respect for the individual's autonomy and preferences in treatment planning. Preventive strategies are also important in addressing depression, particularly for individuals at higher risk due to genetic, psychological, or environmental factors. These strategies may include psychoeducation, resilience training, stress management programs, and early screening. Educating individuals about warning signs and encouraging help-seeking behavior can lead to earlier intervention and reduced severity of symptoms. Prevention also involves building environments that support mental well-being, such as creating supportive workplace cultures, safe communities, and access to mental health resources. Working with individuals experiencing depression requires a compassionate and non-judgmental approach. Practitioners must be patient, understanding that recovery can be slow and non-linear. Some individuals may make progress quickly, while others may face repeated setbacks. Consistency, validation, and the ability to hold space for emotional pain are essential skills. Practitioners should also be mindful of their own well-being and seek supervision or support when needed to remain effective in their roles. Depression is a deeply human experience that touches every aspect of life. While it can be debilitating, it is also highly treatable with the right interventions and support. As mental health and wellness practitioners, the responsibility lies in offering informed, ethical, and compassionate care. By understanding the causes, recognizing the symptoms, and applying a wide range of interventions, practitioners can play a transformative role in helping individuals move toward healing, restoration, and a renewed sense of purpose and connection.